I was 3 weeks from my daughter's due date, lying awake at 2 a.m., mentally rehearsing what I would say to my wife when contractions started. I had this script planned out, calm, reassuring, totally in control. Then I imagined actually being in that delivery room, watching her in pain, not knowing if what was happening was normal or dangerous, and feeling completely useless. My heart started racing just thinking about it. I realized I'd spent months helping with nursery setup and reading about newborn care, but I had zero plan for the actual moment that mattered most, being the support she needed when our baby was born. I'm Dan, and if you are feeling anxious about labor and delivery, if you are not sure what your role actually is, or you are worried you will freeze up when things get intense, you are not overthinking this. This is the moment where your presence matters most, and the fact that you are uncertain means you care about getting it right. Before we dive in, hit that subscribe button. This channel exists to help you navigate fatherhood with confidence, and I post new videos every week. This video gives you a practical action plan for being genuinely ready on delivery day. We are covering what you actually need to know about childbirth so you stay calm, what goes in the hospital bag for both of you, understanding your real role as advocate and support, preparing mentally for what you will witness, discussing the birth plan so you know her preferences, staying grounded when pressure hits because your energy directly affects hers, and what happens in those first moments after birth that nobody tells you about. Your readiness is not about knowing everything. It is about being present, informed, and calm enough to support her through the most physically demanding experience of her life. Point 1. Learn the basics of labor stages, not to become an expert, but to stay calm. You do not need a medical degree, but you do need to understand what normal labor looks like so you are not panicking when things are actually progressing fine. Know the 3 stages. Early labor is when contractions start. It can last hours or even days. This is when you time them and stay home until they are consistent. Active labor is hospital time. Contractions are stronger and closer together. This is the intense part where she needs you most. Delivery and afterbirth is the actual pushing and placenta delivery. Why this matters is simple. Your calm comes from recognition. When you see her having a contraction every 5 minutes and know this is active labor, this is normal, you become her steady presence instead of another person freaking out. Spend one evening watching a basic childbirth video together, not the dramatic TV version, the real medical explanation. You will see that most of labor is waiting, that pain does not mean danger, and that the process has a pattern you can recognize. I watched one of those videos about a month before our daughter was born, and honestly, it demystified everything. I went from imagining chaos to understanding there was a predictable sequence. That knowledge did not make me an expert, but it made me calm enough to be useful. Point 2. Pack the hospital bag for both of you. Your comfort matters too. Everyone focuses on her bag, which, yes, pack that first. Now comfortable going home. Outfit, toiletries, nursing bra, phone charger, birth plan copies, insurance cards, her preferred pillow. But you are going to be there for potentially 12 to 24 hours or more, and you being uncomfortable makes you less helpful. Pack yourself a bag. Phone charger because you will be texting updates. Snacks that do not require refrigeration because hospital cafeteria hours are limited. Change of clothes because you might be there longer than expected. Toothbrush and deodorant. A hoodie or extra layer because delivery rooms run cold, and cash or card for vending machines. Here's what nobody tells you. You might not get to leave for food. You might be her support person for 18 hours straight. Having your own supplies means you are not choosing between your basic needs and being there for her. Yeah, pack both bags a month early and put them by the door. When labor starts, you do not want to be running around looking for phone chargers. I packed mine at 36 weeks. It sat there for 3 weeks. But when her water broke at 2 a.m., we just grabbed both bags and walked out. That small act of preparation removed one source of stress in a moment when everything felt urgent. Point 3. Understand your role. Advocate, comfort provider, and her connection to the outside. Your role is not to deliver the baby or make medical decisions. It is to be her voice when she cannot speak, her comfort when she is in pain, and her anchor to calm. As an advocate, know her birth plan preferences. Pain management, who cuts the cord, Delayed cord clamping, skin to skin, immediately. When medical staff ask questions during intense contractions, you answer or you say, "Can we discuss this between contractions?" You are her buffer. As a comfort provider, this looks like counter pressure on her lower back during contractions, getting ice chips, adjusting pillows, reminding her to breathe through transitions, telling her she is doing great when she says she cannot do it. You are not fixing the pain, you are being present with it. As her connection to the outside, you are updating family, making sure her phone is charged, keeping track of time so she does not have to. Here is the shift. You might feel useless because you cannot take away her pain, but your presence, your calm energy, your steady voice, your hand to squeeze is doing more than you realize. She will remember that you stayed, that you did not look away, that you saw her at her most vulnerable and did not leave. During active labor with my daughter, my wife squeezed my hand so hard during contractions that my fingers went numb. I could not do anything about the pain, but I could stay. And afterward, she told me that mattered more than anything else. Point 4. Prepare mentally for what you will see. It is intense, and that is normal. Labor is raw. You're going to see your partner in more pain than you have ever witnessed. There will be bodily fluids, blood, amniotic fluid, possibly vomit. She might scream. She might cry. She might say things she does not mean. "I cannot do this. I hate you. I'm done." This is not a movie montage. It is hours of intense physical work. Prepare yourself now. What you are witnessing is strength, not suffering. She is not broken. She is doing something her body was designed to do, even though it is the hardest thing she will ever do. Your job is not to be squeamish or look away. Stay by her head if you prefer, but stay present. If you start to feel faint, tell a nurse immediately and sit down. Passing out helps no one. What helped me was reframing pain as purpose. Every contraction was bringing our baby closer. When she said, "I cannot do this," I learned to say, "You are doing this. You are doing it right now." That shift from "you can" to "you are" made the difference. It validated what was happening in the moment instead of asking her to reach for something that felt impossible. Point 5. Discuss the birth plan together so you can speak for her when she cannot. The birth plan is not about controlling the uncontrollable. It is about knowing her preferences so you can advocate when she is too exhausted to explain, and sit down together and talk through these questions. Does she want an epidural or does she want to try unmedicated? Know that she can change her mind. Support whatever she needs in the moment. Who cuts the umbilical cord? Does she want immediate skin to skin, or does she want baby cleaned first? What about delayed cord clamping? Does she want the room quiet or does she want music? Who is allowed in the room? What are her fears? What does she need you to watch for? Write this down, make copies. Give one to her care team when you arrive. But here's the critical part. The birth plan is a guide, not a contract. Things might change. Emergency C-section, interventions she did not want, exhaustion changing her mind. Your job is to support her real-time decisions, not enforce a document. When she is in transition and the nurse asks about pain management, you know what she wanted, but you also check in. You said you wanted to wait, but if you need it now, that is completely okay. We had a birth plan. We discussed it multiple times, and then during labor, things shifted. She decided she wanted the epidural earlier than planned. I did not remind her of the plan. I supported her choice in that moment. That is what advocacy actually looks like. Point 6. Stay calm under pressure. Your energy is contagious. Here's what nobody prepared me for. She will look to you to gauge if things are okay. If you panic, her anxiety spikes. If you are calm, she feels safer. This does not mean faking confidence. It means managing your own fear so it does not become her burden. Practical tactics for you. If you start to spiral, step into the bathroom for 60 seconds. Splash water on your face. Take 3 deep breaths. Remind yourself the medical team is here. They know what they are doing. Complications are rare and they are prepared for them. Do not voice every worry out loud. If you are scared, tell the nurse quietly, not at her bedside. She has enough to handle. Trust the process and trust the professionals. When things get intense, your presence is your power. You might not know what to do medically, but you know her. You know what calms her. Use that. Lower your voice, slow your breathing. Maintain physical contact if she wants it. You become the steady thing in a storm of sensation. This is your moment to show up. During the pushing stage, I felt my own heart racing. I stepped back for 30 seconds, took a breath, and came back focused. That pause let me be what she needed instead of adding my anxiety to hers. Point 7. Know what happens right after birth. The first moments nobody explains. The baby is born. Now what? Here is the sequence. Baby comes out. They might suction the nose and mouth. Check breathing. If everything is good, baby goes directly to her chest for skin to skin. This regulates baby's temperature and heart rate. The umbilical cord gets clamped and cut. You or the doctor per your plan. She delivers the placenta, another few contractions. Yes, it continues briefly. They will do immediate checks on baby while on her chest. APGAR scores at 1 minute and 5 minutes. They will weigh and measure baby, usually after an hour of skin-to-skin bonding time. You might get offered to cut the cord. You do not have to, but it is a moment you might want. What surprised me was how vernix-covered and cone-headed the baby looked initially. Totally normal from the birth canal. How alert my daughter was in that first hour. Eyes open, looking around. How emotional I got hearing her first cry. The room goes from intense medical emergency energy to this quiet, sacred bubble. You will probably cry. That is normal. This is the moment you became a father. Let yourself feel it. Take a picture if you want, but also just be there. You do not get this moment back. Looking back, that 2 a.m. anxiety I had 3 weeks before delivery was not wasted energy. It was my brain telling me this matters and I need to prepare. And the truth is, no amount of preparation makes you feel completely ready. But being informed, having a plan, understanding your role and committing to stay present even when it is hard, that is enough. You do not need to be perfect. You need to be there. You need to be calm enough to support her. And you need to remember that your presence, even when you feel like you are doing nothing, is everything to her. Labor and delivery is the most intense experience you will both go through together. It is raw, it is beautiful, it is terrifying, and it is the beginning of the rest of your life as a father. You are going to do great. Not because you know everything, but because you care enough to prepare, to show up, and to stay. That is what makes you ready.